Okay, so good morning, everybody. This is the regularly scheduled meeting of the Board of Fire Commissioners. Date is Tuesday, October 2nd, 2018, and the time is 9 o'clock in the morning. Thank you. Flag salute, Renaissance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please join me in a moment of silence in honor of past and present members of the Los Angeles Fire Department who have devoted their lives to the protection of our community. Thank you.
So we start with Commissioner comments.
Oh, I just want to welcome Chief Rideout. Haven't seen him in a long time. He's back.
Great. All right. So moving on to report of Fire Chief.
Thank you, Madam President. And we all have welcomed back Chief Rideout after his long absence. We're happy to see him back with us. He's been a great resource. He continued to be a great resource while he was off duty. We continually were emailing, phone calling. Sometimes I went down to have lunch with him, and his return was very well received. So welcome back.
Welcome back.
Other items during this period last week, let me back up before that. A couple weeks ago, we had a near-miss incident involving our firefighters who were on the roof of a commercial building, and we nearly lost 4 firefighters. Had they been more in the center of the building when the roof collapsed, they most certainly would have perished. We immediately took care of our members, and one member was hospitalized with serious burns. The 3 other members were not injured, thankfully. We were within 48 hours of that incident. We put out a blue sheet which contains all the basic facts so that the entire department can review and train. We have a significant incident report in process right now. We'll get that in a week or two. That'll have more in-depth analysis of the incident. And then last week, I put out a message about emergency incident decision making. I wanted to ensure we had a consistent way of deciding when it's appropriate to take great risk and when it's not appropriate to take great risk. Mm-hmm. When people are at risk in a building, civilians, we take an oath to do all we can to save them, to protect lives and property. When it's a building that is well involved with fire, commercial building, and very unlikely anybody is inside, we take no risk, and we should make those decisions accordingly. So part of that effort, we've had a safety stand down yesterday, today, and tomorrow. That's why today our geographic bureau commanders and Chief Poyer are not here. They're out visiting stations, reiterating this message. I was out yesterday, and I plan on being out tomorrow to continue the discussion. I think it's something that you have to begin the process and incrementally grow it throughout the organization, because it's not something like hitting a light switch. We're trying to change the culture here and implement a way of making sound decisions. So I'm very proud of the efforts of our people at that fire. The fire was successfully knocked down. The injured firefighter did receive 3rd-degree burns to his right hand, and he will be back to full duty in 6 months. So we were very, very fortunate for that outcome. Now, moving on to other issues, I was in Sacramento last week for the Cal Chiefs Conference, and we talked about a lot of things. The thing that was important to us in terms of revenue is that the brush fire pre-positioning, Governor Brown signed a bill, SB 901, which makes available $25 million to fire departments who pre-deploy their resources in anticipation of a brush fire. So I learned about some of the rules and the criteria for that. So we'll be using some of that money whenever we pre-deploy. We also were very supportive of a bill that we've been pushing for a long time, and as well as Mayor Garcetti had made a phone call to Governor Brown in support of our medics being able to transport directly to a specialty center like the Sober Center or the mental health clinic. Right now, the only people that can go there are the advanced provider response units or LAPD. It's funny that police officers have more latitude to transport than we do. And because our paramedics have to comply with the Department of Health Services protocol, that's why they take them to the closest emergency room. So we're optimistic that will be signed, and we have not heard as of yet. Saturday in Sacramento as well, I stayed an extra day because it was our annual California Firefighter Memorial Service. We had one member placed on the memorial wall. It was Captain 2 Dave Mormon, and his family was there, the honor guard, a lot of people from the LAFD were there to support the Mormon family. Our goal is for next year not to go. That would mean that none of our people were put on the wall and that nobody passed away in the line of duty. That concludes my report.
Thank you. Moving on to verbal report by the medical director relative to medical emergencies for August 18th through October 1st.
Good morning, Madam President.
Morning.
Good morning, Commissioners, Chief Terrazas, City Attorney. Good morning, Isela. I'm Ellsworth Fortman, Assistant Bureau Commander of the EMS Bureau. A couple incidents to talk about. On September 20th at LAX, we had Engine 51 and Rescue 95 respond to Terminal 3 for an 81-year-old male in cardiac arrest. It happened at the TSA screening where the TSA officers were able to use the AED from LAX, shock the person twice, began CPR, and that patient had a return of spontaneous circulation prior to our companies even arriving at the scene. The patient remained in that condition throughout the transport. Of note of that, too, was that we did have a cycle team assigned to the airport at that time. The cycle team was on another call during that call, but that also freed up Rescue 95 to be able to have their quick response to the airport with the cycle team being on that call. Interesting side note to this also is that during the month of September, 41% of our cardiac arrest patients had a return of spontaneous circulation, and 62% of those that were in cardiac arrest with a shockable rhythm had a return of spontaneous circulation. So really good month for saves for our members out there. Another incident we had September 21st, we had a shooting with two adult patients shot at 242 East 85th Street. This also included a barricaded suspect where we had a fire company, 3 paramedic rescues, and our TEMS paramedics assigned to assist with LAPD SWAT. Both patients survived, were transported to local trauma centers. And then lastly, the LA Magazine published an article on September 28th regarding our APRUs. They did a long interview that happened a couple weeks back with Jonathan Lang. He's a firefighter paramedic assigned to AP 15, and he's been in that assignment for at least a year now. Really good article. Highlighted our not only the AP units, but also our SR unit here in downtown. So, and that's the end of my report, unless there's any questions.
Thank you.
Thank you.
Moving on to presentations. I think we have one.
Good morning, Commissioners, Fire Chief Terrazas, City Attorney Ms. Iniguez, Eric Scott, Fire Captain Paramedic, and Public Information Officer. Today we do have a presentation to recognize the off-duty actions of engineer Danny Lynch, who selflessly saved multiple homes in his neighborhood during the raging Thomas Fire that happened in Ventura County. We're also fortunate today to have Captain Dennis Cameron of the Torrance Fire Department. He was on the Thomas Fire as a strike team, and that's who Engineer Lynch had teamed up with. So we feel it's appropriate to ask both of them to please come up and stand near the podium. But the incident took place on December 3rd and 4th in 2017, and Captain Cameron's engine company arrived into the city of Ventura around midnight, which was Engineer Lynch's neighborhood. Now, at this point, upon their nighttime arrival, they had multiple homes that were burning and civilians were working to evacuate out. So fortunately, Danny had his turnouts with him while he was off duty. He approached Captain Cameron on the street, identified himself as an LAFD firefighter, and asked if he could help. So at this point, there was homes on both sides that were on fire of that street. And as you could imagine, due to the massive fire, resources were spread very, very thin. So Captain Cameron gave Mr. Lynch some quick direction, and Danny took off. He grabbed a hose line, he went to a house that was just starting to light off, and he swiftly went to work to save it. Sure enough, a few minutes later, he comes back saying that the flames were in the attic, and this time he needed a pike pole to allow him to pull ceiling to make access to the attic to further extinguishment. He got one, took off again, went back to the house to save it. A few minutes later, he returned again, this time for a chainsaw and a ladder. As you can see, he keeps upgrading his equipment here. But this time, Captain Cameron went with Engineer Lynch to check on the progress of the home. And at this point, he had already pulled the ceiling, knocked down the bulk of the fire from the inside, but realized that the roof needed to be opened to fully extinguish and to ultimately save that residence. So both these members went to the roof, they cut several holes, and then brought hose lines up to the roof to have that complete extinguishment. And Engineer Lynch spent almost an hour there by himself to make sure that that house didn't burn down. But he didn't stop there. His actions continued. At this point, he pulled his hose line down the street to assist firefighters with other homes in his neighborhood that were burning. And he continued to work with the strike team throughout the night until the water supply, as you might remember, ultimately was lost, and all companies were forced to retreat. But it's important to mention that the Thomas Fire at that time was the largest wildfire in the state of California that they had ever seen at that point. And there was about 240 homes that were threatened in Danny's neighborhood alone. So again, those fire resources were stretched to their max. And so Danny, although at times was required to act alone, which is not normal, he made calculated operational decisions. And this was based upon safety, situational awareness, and he ensured he was wearing full protective personal equipment, and he maintained close communication with the strike team captain. So due to these courageous actions, Engineer Lynch was responsible for saving several homes, and for that, he's to be commended. At this point, we'll read the Certificate of Appreciation to Daniel J. Lynch. In recognition and sincere gratitude for your heroic courage, diligent efforts, personal initiative, and expedient assistance, which directly resulted in saving several structures during a historic wildfire on the morning of December 4th, 2017, in the city of Ventura. The Los Angeles Fire Department commends you for your extraordinary efforts to the citizens of the city of Ventura, California. Presented this second day of October 2018, Ralph M. Terrazas, Fire Chief.
I'm so proud of our firefighters. We hear of all these outstanding deeds that they perform, not only in the city, but when I think about in the past presentations, we had somebody who was on vacation in Australia who saved somebody from a shark attack. We had multiple people in Las Vegas for the Las Vegas shooting, which was the anniversary yesterday, the 1-year anniversary of that shooting, and many of those people are getting a Medal of Valor. And we have Danny, who closer to home, off duty, he saw a need and he took an action. And the action that he took resulted in the saving of multiple houses, perhaps as many as half a dozen, I'm told. So Danny, we're very, very proud of you. It shows what excellent training you've received from Los Angeles Fire Department and what excellent equipment that you have, right? And maybe we should give you an engine, because that seems like you're going back to Torrance Engine for all their equipment. But we're very, very proud of you, And I want to turn the mic over to the captain from Torrance, and then we'll let Danny speak. Here we go, Cap.
Thank you, Chief. I'll keep it brief. It was an honor that night to meet Engineer Lynch. He approached me on the street, and as we mentioned, he identified himself as a Los Angeles firefighter, which immediately gave him some street credit because as firefighters, we size each other up. And he looked like he was willing to go to work. He was capable, and took him under our command, said, hey, just report back to me, don't freelance. And as we mentioned, Chief, he had some calculated risk, but that risk was managed in his actions. We've covered the tasks he did that night as far as utilizing tools and equipment. He was more than well-trained. He was an expert in his craft, and that I got to witness that firsthand. What we didn't speak about is what he did that night as he left his home, left his family, grabbed his turnout gear, and went to work without anybody calling him. That speaks to the character of Danny Lynch. Character is something we can't train in our firefighters. We could teach them how to use the tools and equipment. We could teach them what to do when responding to emergency, but we don't know if they'll have that character when duty calls. My department, our motto is desire to serve, ability to perform, and the courage to act. Danny showed up that night with a desire to serve. He showed me he had the ability to perform, and then he showed me he had the courage to act. It is true, I got to see him operate, and I truly believe he was responsible for saving multiple houses that night. We were stretched very thin as we rolled into Ventura that night. We figured we'd be rolling into staging or base and then getting assignment. We rolled right into a neighborhood with houses on fire on both sides of the street and just spread out and went to work. Him showing up, an extra hand made a big difference. I'm honored to be here, and I'm honored to see him get recognized for his actions. He truly deserves it, and I'm glad I got to meet him.
Thank you, guys. Thank you, Cam Cameron. Thank you, Torrance Fire Department, for letting a off-duty LA City firefighter work with them. It was a tragic thing that happened in my own neighborhood, so I felt like I had to do something since I was there. Thank you to my wife. We can all say happy birthday to her. She showed up. So, it's an honor to be here. Honor to receive such a award from everybody, and it's the training that the LAFD has given me and training throughout my childhood that my dad and my parents have given me. So thank you.
Let's take a picture with your wife and then the crew from 88
Yes.
and then the Torrance guy.
Yes.
We'll go right up front.
Okay.
I know, it's amazing.
Another one on the way.
So, consent agenda items.
Okay, move to adopt the recommendations for items 4A through 4E.
Second.
All in favor?
Aye.
So we have one regular agenda item. It's a report by the department on the LAFD Information Technology Bureau quarterly update.
Hi, good morning. Scott Porter, Chief Information Officer for the Fire Department. Good morning, Commissioners, Chief,
Good morning.
the Attorney. This is my quarterly report. I did make some changes since the last report. I am trying to line up the format of this report with our new IT strategic plan, which is lined up directly with the Fire Chief's strategic plan. So the format's a little bit different, but the content is similar. I'll just run through these quickly and then available for any questions that you have. No lack of activity in the technology area for the fire department. I see that as being sort of our mode for the foreseeable future. The theme has been we have an overwhelming number of projects and a limited capacity. So we're trying to be very smart about how we prioritize the things that we're working on and make sure that they're all in good alignment. In the Fire Chief's strategic plan, goal 3 is to implement and capitalize on advanced technology. Within that goal, we identified 4 strategies. All of our project portfolio now has been aligned with those 4 strategies. There are, just to note, a couple of IT-related things in other goals and strategies, so those are in my overall plan, but these are sort of the highlights that are focused on technology. The first one is implement enterprise analytics and reporting. We've been making very good progress in terms of centralizing on a enterprise reporting tool. It's a tool from Microsoft called Power BI. The technology is particularly interesting because it gives us a lot of capabilities to not only do our reporting, but also to visualize data in new and interesting ways. And it's sort of a first venture for the fire department into the cloud technology. And basically, the thing to take away from that is it's a lot of computing power available to us and a lot of tools available to us that we don't have to actually buy and put in-house. So we're pretty excited about that. Microsoft is making a considerable commitment of energy and resources to the fire department. We just had a 3-day, we hosted 3 other departments, city departments, plus ourselves, had a 3-day intensive workshop over at MFC. With Microsoft to sort of dive deep into this area. So we're pretty excited about that. The specifics, we're going to be implementing essentially all of the FireStat reports are now moved to Power BI, and we're now testing and we'll be implementing in the next couple of weeks. These reports will be available to members on the portal, directly through the portal. So trying to provide members better access to this data, and then we'll start to get feedback from them and continue to enhance those. We're also looking at specialized units within the fire department to start to take some of the tools that were only available to FireStat and move those out to the units. EMSQI is the first one, going to be giving them tools, the EMS Bureau giving them tools, and eventually out at the Bureau offices. So we want to be able to really empower the command staff and also the members to visualize and use this data, but focus on one sort of single source of the truth of the data. So a lot of exciting things going on there. Strategy 2 is improve emergency communications infrastructure. This is largely around radio and fire station alerting project. On the radio front, we will be starting to accept delivery of our new portable radios probably mid-November. We're on plan right now, working with Motorola and ITA to begin the deployment and fielding of those radios, and hopefully, at least for the Valley Bureau, have them all deployed before the brush season. And if you remember, the real purpose of those radios are they're multi-band radios, so members won't have to carry multiple radios when they operate in these brush areas. So we're pretty excited about that. These particular radios also have some more advanced features that once they're fully deployed, we'll be looking at things like we can get the location of the radio brought back so we can actually see members moving around with their radio. And there's a lot of more advanced capabilities, so we're excited about that. We're also working with ITA, putting together it'll be in ITA's budget, but it'll be a joint presentation for the next budget cycle. We do have some radio infrastructure work that needs to be done. It's basically the maintenance of our existing radio infrastructure. The priority for the city has been the citywide public safety radio system, which is essentially primarily PD's new radio system. That's underway, and now it's time for us to just do some maintenance work on our radio system so we can get another 10 or more years out of it. So we'll be working on that. And then also on the emergency communications infrastructure, we're making good ground on fire station alerting. If you remember, in last fiscal year, we got about $1 million. That $1 million has gone largely to improve the network. So we're working with ITA and starting the build out of the new network to all the fire stations. And then in this fiscal year, we have money allocated to continue those improvements on the fire station alerting system. So that's underway. And then we also, I think since the last time I was here, we have worked out the reimbursement with Cal OES for our E911 phone system upgrade, which is there was about an $800,000 gap, and we've been able to work that out to no gap. So essentially, we'll be working on in calendar year 19 upgrading the E911 system over at MFC. The two big wins there is one will be eliminating the so-called transfer time delay. So today, the way the systems are designed, PD has one system, we have a different system. When they transfer calls to us, essentially it has to go out the 911 network and come back. That'll be eliminated with this new phone system. And we'll have what they call cradle-to-grave reporting, meaning we'll be on the same reporting platform. Today, when we report on call processing time, we really can only report on the time sent when we receive the call. That caller may have been on the line with PD for several minutes, and we don't see those times at all. So we'll be able to visualize and see those times. So those are two really good ones. Moving on to workforce management, the couple of things there that I think are particularly noteworthy. We are working on the network staffing system replacement. That RFP is out. It's due back at the end of the month. And we're looking either for a vendor to come in and help us to sort of build the next generation of network staffing, but we've also allowed room in the RFP to allow vendors that if they think they have a commercial software system that could do this scheduling work, we're open to receiving those. So by the time I come back in the next quarter, I'll have a report on where we're at with that. And then we're also, one of our main back-end systems is called MITS. That's sort of our human capital management system, and that's on plan to be basically rewritten and retired and replatformed onto another internal system. So those we're making progress on. And then in the last category, which is really sort of a catch-all for all the other exciting projects, we're making really good headway on AVL. We, as part of the Bike Medic program, we've implemented MDCs on a mobile phone. That was a big piece of that. We made some pretty significant enhancements to the CAD map. In terms of fire prevention, we are getting very close to making a decision about the new fire prevention management system, which would eventually retire FPAWS, FPA, and a whole number of other small spreadsheets and little systems that we use to collect fire prevention data under one system. So likely by the time my next report, we'll have some information about that. So that concludes my report. I'm available for questions if you have any.
Thanks for the report. Good, lots of good stuff going on in here. On the Power BI, it's a great platform. I've used it in other places. It in the right hands, I think you can get really powerful, just a visualization of the data.
Yeah.
Is that something that we could use our credentials to look at as well?
Yeah, I think so. So I think once the reports are published, we'll be able to get login credentials for all of those published reports. So I could take that away and look
Okay,
at that.
yeah, it'd be great if you could. I have a confession. I've never actually figured out how to use my LA City credentials
Okay.
for anything.
I'll
so
send you to ITA for that.
yeah, but if you could, maybe that's something we
Yeah.
could set up. It's just an opportunity to understand how we can access the portal and be able to look at the published reports and
Yep.
play around with the Power BI stuff because it is a great tool.
Yeah.
I'm excited that it's. I know we've been using it for some time, but
Yeah.
I'm glad to see it sort of catching fire.
It
so to
is
speak.
catching on, yeah, for sure.
All right. On the network staffing RFP, that's great. Was that? It says it was reissued. Did we issue it once and then try it again?
We did issue it once. We had some procedural issues where many of the vendors that responded were immediately disqualified because there was some vague language in terms of some of the city's procurement rules. And so we felt like we weren't going to get a good response, so we corrected that. We also had some questions about whether or not it had to be custom versus commercial off the shelf, so we corrected that and then we reissued it.
I see. Okay. Let's say you get something back in the end of October. Do you have like an inside-outside time frame for when we might see a new network staffing application?
Yeah,
I know there's different, depends on whether it's commercial or...
Yeah, no. I mean, I think it's all. So there's a couple parts to that. Let's call it a year, right? We select a vendor, we contract with them, and we give ourselves a year for the first thing to actually be implemented. The good news side of it is we are trying to be very smart about what's actually in the new scheduling system. So network staffing over the course of its years, for a lot of good reasons, morphed into more than just scheduling. There's a lot of things in there. I mean, it even supports some of our fire prevention stuff. So our intention is not to replace everything that network staffing does with this new system. So the scope is very limited. It's scheduling, hiring, and timekeeping. Another sort of limitation of the scope that I think is going to help us on the time frame is all of the rules about how someone gets paid based on where they worked and what they were doing when they were there. Those really belong in PACER. So we're working with the controller's office and their PACER replacement to make sure we're in alignment with, hey, we're going to tell you who worked where and what they were doing when they were there, and you're going to apply the MOUs and figure out. So that, I think that's sort of the other side of it is we're limiting the scope, but that's all very complicated and it's new. So that could potentially extend it as well. So the approach we're trying to be very mindful of, this is really our scheduling and hiring and timekeeping system. Everything else, as NSS gets replaced, is going to go into the appropriate systems.
I know it's late for the RFP, but one request maybe you could add in there that whatever we get, it has to continue to be in DOS.
Yes. Yes, the user interface cannot change.
That's right. So it should continue to be
Right.
require coding. Good. That sounds good. I look forward to seeing how that turns out. I know that this has been a long-standing irritant in the field, so looking forward to seeing where that goes. On the AVL and the CAD enhancements, so I know that we are trying out, or we've been trying out the AVL dispatch through the CAD. Is that right?
We are doing AVL. I mean, it's more than trying it out. We are doing, so today, the way we select, before AVL, right? We assumed everyone was in a station. If they're in quarters, they're in their station. If they're driving around, we sort of assign them to a station. And then for every address, we say, okay, for this address, this is the order in which we look at stations. When we implemented AVL for one algorithm, which covers some number of types of calls, we said, okay, for this particular algorithm, let's use where the units actually are located. And we did that so that, one, we could not do this, completely blow up how we do unit nomination, because if we were wrong, or we got it wrong, then we would have sort of a catastrophic citywide effect. So we intentionally limited the scope. So these are sort of low acuity ALS calls where we're looking for ALS rescues and then other types of equipment. So that is in place today. We use AVL for that today. So if those calls come out, we actually look at where the unit actually is. What we've been doing since then, our original approach was we're going to go for another algorithm. We're going to sort of keep chipping away at the different algorithms. But with the data that we got back, what we said was it's probably better to refine this algorithm. For example, because we didn't have precise location, we would say, hey, if the ALS unit is more than half a mile away, then go look for the next BLS. Well, half a mile might not be right if the ALS is correct. So one of the things we're trying to do is not only just reduce response times, but we're trying to reduce over-dispatching. We tend to over-assign units because we don't really know who's closer, right? So we'll send a light force, an engine company because they're an assessment engine company, a BLS ambulance, and an ALS ambulance, only because we're not precise about the location. So what we're doing right now is we're looking at all of the response data on this algorithm, which is pretty significant, and we're going to probably start making adjustments to the algorithm itself, learn from that, and then go for the next algorithm. So it's sort of a combination of you got to work with MFC, you look at the EMS Bureau because we're looking at their response times and outcomes. We look at the IT side, which ones sort of have where are all the dials that we can actually adjust. So that's the approach we're taking. We're trying to take a cautious approach because we want the technology to be good. While all that's going on, we're also starting to field test broadband, which enhances our actual AVL location data, enhances the reliability of it, it enhances the sort of precision of it. So we're sort of moving in a couple of different areas at the same time. But in terms of the actual algorithms we're going for, we're taking this more methodical approach.
And how long have we been doing the AVL-based dispatch? It's been like a year now? Or
it's a little bit less than a year.
Less than a year?
Yeah, it was this summer we actually started.
Yeah, I mean, I think that it might be worth a fuller discussion. I think AVL is one. It's super interesting to me, but there are some profound consequences, not bad consequences, just sort of generically consequences, or for our department and sort of the operational model. It might be interesting to have a fuller discussion about where we've come from, what the lessons we've learned, and kind of what the ultimate vision is just from a planning standpoint as we start to think about what the future looks like. Is that something that you would do, or would that be something you do in collaboration with emergency operations? Or
everything I do is in collaboration with emergency operations.
Naturally.
I don't do anything on my own.
Of course.
Right? Yeah, I mean, I think this is really it really is an operations problem.
Mm-hmm.
We're just applying different kinds of technology to it in different ways.
Yeah.
So yeah, I think it's an operations question. To your point, another example is we sort of expected it, but we didn't expect it to be so great, is AVL really helped us with just overall unit availability. For example, we know when units are moving throughout the system now where we didn't know before. So if they're moving in a status where we wouldn't expect them to move, we know. So we check. Are you really in that status? Or you're not in that status? And it helps with unit availability and just the overall situational awareness at MFC.
Yeah. Yeah, I think you hit a couple of points there that obviously have ripple effects out, how it gives us much more visibility into things like wall time or, travel availability if people are running through and, on the way home from a hospital or whatever. I think those would be interesting things to try to just enlighten the commission about. So I think because we all have an idea of what the state of play was, pre-AVL, but it sounds like the state of play may be actually pretty different now with all this new data. So maybe that's something that we could have a larger discussion about sometime before the end of the calendar year with your whoever would like to join you up there.
Yes.
Okay, that'd be great. Also related to the CAD, so 6 years ago we started talking about the CAD. This was a little prior to your involvement in any way, shape, or form with it. But we had some deep concerns about the viability of the CAD and whether it was going to break down and redundancy and all that stuff. And then we had an excellent report from Gartner, and we learned a lot about what was there and determined that ultimately, the guts of it were pretty good, and that we needed to kind of make some longer term changes to it that including disentangling fire station alerting, but also thinking about redundancy. How is that going with the CAD? What is the state of the CAD today? Is the state of the CAD
Sure.
strong, or is it?
No, I'm still very confident in the CAD. The state of the CAD is actually very good. The things that we were at risk for, as was mentioned in the Gartner report, were really things that have been addressed. The underlying infrastructure of the CAD, we actually are in the process right now, because it was on hold for so long, just uncertainty. We're replacing all of the servers, for example. We just finished one, another one will go in this week, and then the remainder will go in over the next couple of weeks, which is essentially, okay, we've refreshed now 5 or 6 year old hardware. That's all been refreshed. With the hardware refresh, we get the latest versions of the operating system, the database, and all the underlying software. So in terms of sort of its modern guts, that's all totally up to standard today. I think the hardware replacement that we're in process of doing now is significant, because not only for performance and redundancy, but also, this allows us to do more things with mapping and AVL and whatnot, because we have a good underlying infrastructure. I think CAD is one of those where we just need to look at every couple of years. I still attend conferences. I talk to vendors all the time. I'm pretty aware of what's going on in the CAD marketplace. I'm keeping a close eye on what PD is doing with their CAD upgrade. So in terms of being connected to the market, I feel really confident, and I think we just need to look at it again. For us, the big decision was, you look at it and you say, oh, wow, that looks kind of old because of the way it looks. But the performance of the system and what we needed to do is performing. So we had other priorities. Fire station alerting was the big one, right? I mean, we have 20% of our stations are down because of a network, right? That's like a real operational impact. So we have to prioritize. A couple of years from now, we'll look at CAD again and see where we're at. But for now, I'm really confident in sort of where we are with CAD.
Yeah. When was that Gartner report? How long ago was that?
Well, I've been here almost 2 years. In March will be 2 years.
Seems like yesterday.
I know. And it was within a year of that, so let's call it 3 years ago.
Okay.
3 years.
Yeah.
Yeah.
So I think
Yeah.
that was. It seems like it might be time then, if it was 3 years ago, and maybe this is like a Q1 of 2019. But to actually revisit the question of the CAD and where we're at, because that's basically what I mean, the report said what you just said, and hearing you say it reminds me that basically it said, it's fine for now, there's upgrades we can make, there's things we should do, we should be looking at this about every 3 years to see whether this is still the right place for us, and what we should do. So maybe that's something we could look forward to in Q1, is that we get a more in-depth report on the state of the CAD and the progress there, and where we want to go.
It'll be pretty close to what I just told you. I think this 3 year mark is we've made a commitment to doing the infrastructure upgrades and investing in the hardware, but I certainly could go into more detail about sort of where we're at. We have a pretty healthy backlog of enhancements that we'll be doing to the CAD, so that'll sort of color what our investment is going to be.
So that's great. Yeah, I mean, I think seeing a Gantt chart and being able to kind of see look, what are the improvements that we have? What is it going to do? Why were these the choices for the investments here? Not second guessing, but just sort of helpful to understand, that this is how we're thinking about it, and this is what we think is going to extend longevity out for another 3 years. So when we come back again.
So if I included that more detailed in my next quarterly report, how would that?
Sure, you could put that in your next quarterly report. I would just make sure there's like a good section on CAD and everything going on with that and what the timelines are, and a more robust discussion of what's happening there. And then last thing on the MDC. We got the MDCs. We have broadband now pushing down to the MDCs. Is that right?
We're piloting broadband. So we're going to be doing a limited, probably 50 devices in the fleet of 600. But where we're going to be testing broadband and the radio network simultaneously.
Got it. And then when we test broadband, what is it? What are we testing?
So basically what we're testing for is a couple of things. One is what does broadband look like in terms of coverage, reliability, and performance against the radio network and together with the radio network. So for example, today we get AVL updates from units. Depending on what status they're in, it changes, but let's call it from 30 seconds to 5 minutes. Right? Some statuses we don't need them so frequently, other statuses and we want them more frequently. The only reason we actually do that is because the radio network has a limited capacity for for receiving these updates. We can't receive them all the time. Well, broadband doesn't have that limitation. So when you look at your phone and you're waiting for your Uber and you see the car driving around, it doesn't jump, it just drives around. With broadband, we would get that. So we're going to test, is that worth the investment to have that sort of level of communication on the AVL for our whole fleet? Because there's a cost with that. We have to pay for it every month. We have to buy new equipment. We have to outfit every vehicle, right? And does that cost offset some operational advantage? So we'll be looking at that in this pilot, and then over the course of 2019, making some decisions about how to deploy broadband.
Okay, great. And then on the MDCs, the maps, which we talked about a couple years ago when they first started getting the new MDCs in.
Yeah.
Is that mapping is that still on the docket to happen?
Yeah. So enhancements to the MDC software, including the map, which is primarily the actual look of the map and then the features that we can put on top of the map, is also one of the things we'll be testing in the broadband pilot. Another reason to have broadband is because some of the features of the map require a more robust network than what we have.
Got it.
So that would be another feature. So your map would be more like something people are used to on their phone, for example.
Which is what everybody is using.
Right.
right now.
Or multiple phones.
Or yeah, so you'll have 3 out of 4 members have got their phones out, all giving different advice on which directions to go. It's like a New York taxi cab. Okay, great. Well, this all sounds really good. I'm excited for your next report and to hear more about the CAD, and then also maybe for that sort of special edition to kind of dig into AVL and learn a little bit more about how that's going.
Yep.
Great. Thanks for all your work.
Good. All right.
All right.
Yes.
Yeah. No, I also want to say this is fantastic. All the work that you're doing is incredible, and I just and I mean, this is not my wheelhouse, IT at all. But what I do want to see in here, and I'm just kind of reiterating what Andrew was saying, are timelines.
Yeah. Okay.
If you can, in your next report, if you could put timelines and measurable goals, which would be very beneficial.
Yes.
So we can track that.
Yes.
So I appreciate that.
Okay, will do.
Thank you. And this is fantastic.